Welcome to this week's episode of the Sink or Swim podcast. This is episode 3. If you've made it this far, thank you for listening. On today's episode, we are going to be talking all about research. Research is something that scared students like me. I know that scares a lot of students because it's so nebulous and intimidating until you get involved in it. So to kind of break down the walls, we've brought a very special guest with us this week.
We've brought the man, the myth, the legend. You all know who he is. It's Dr. Bauckman. Dr. Bauckman, hello, welcome.
Hi, thank you for having me.
Thank you for being here. I think it's important that you're here because I think you are a bit of a mystery to a lot
Am I?
Oh, for sure, right?
A bit of a legend, I would say. Well, for us, when you were the first course director we had.
Yes,
you were
technically you had
the
PI
one.
though.
Well,
you had professional immersion, 2 weeks.
Nobody remembers that. Sorry, Dr. Griffin.
PI was definitely helpful, and it was definitely our first block. But fundamentals was the first challenging. It felt like the beginning of medical school to me, and I'm pretty sure everyone.
That's fair.
It was, micro, immunology, anatomy, the tough stuff right off the beginning, and you were the head of that, so you were the first authority figure I think a lot of us had academically.
Yeah, you set the tone for what to expect in medical school for everybody in our class and the 3 classes after that.
And I think it went well.
I think it went well. Well, I mean, it wasn't without its challenges, right? We can all admit that.
That's fair, yes. I think it was challenging probably for both sides.
I was just about to say that. For as challenging as it was for us and as challenging as it's going to be for any med student, it had to have been extremely difficult for you all because brand new med school.
Yeah, and just the quick recap, because we talked about it before probably twice now, fundamentals was the first block of learning we did as a charter class where we went through the basic sciences, mostly biochemistry, anatomy, micro, pharm, really heavy hitter, immunology. Yeah, very
genetics,
tough stuff. Very tough stuff for a new medical student.
Some pharmacology, like pharmacokinetics and stuff like that.
And Dr. Bauckman was the head of it, essentially. So
he's the course director. Tell us what you do as a course director.
So course director is essentially the architect of the course. So manages a lot of the background things, so making sure all the lecturers have like their objectives in order, that everything aligns together as much as possible. It's meeting the standards for the curriculum as a whole, and that it somehow will connect down the road to the systems classes that you have. So we do have a systems-based curriculum. So if people are tuning in from other schools, not every school is going to have that. Most are moving towards that, but who knows? With STEP being pass-fail now, that it might be a shift away from that for down the road. I don't know. But yes, the goal with fundamentals was to give the basic sciences, right? So I think there's about 13 core basic science topics. They would have all been graduate level courses individually, but they're all in 12 weeks.
So how do you know? I mean, I imagine there's some sort of master document provided by the overlords of med schools, not just ours, but every med school. How do you know what to do? I mean, this is brand new med school. You're starting it from scratch, this course. How do you know what to cover?
It can be challenging. Yes, you're right. There is a master sheet. USMLE has has its own mapping system. So you can look at that. You can look at the basic sciences, and you can say, oh, this is what is going to be on the step 1. So these are going to be the essentials, at least going forward. Obviously, everything is for applying, but these are the things that you're probably going to see assessed. That sounds perfect, but I don't know if you looked at the USMLE objectives and how they map. But you get ones that are like cell biology, and that is one of the objectives. USMLE, if you thought your assessment objectives were vague, they're even vaguer for USMLE.
So that's one of your objectives, just cell biology. That's it.
I guess from your perspective, because I've seen the PDF, I'm pretty sure the same one you're talking about, where it's basically every topic that can be on the USMLE. So from my perspective as a student, I guess it's kind of similar to you. When you see something like cell biology, we're like, well, all right, that's pretty vague, but just all encompassing. Like there's a lot of stuff there's a whole class in undergrad or multiple classes on cell biology. So how can you summarize that into one little topic?
It's challenging. I think historically, not at our school, a lot of professors would essentially just teach whatever was their favorite topic, and they would do that. And I think there's been and again, I'm speaking anecdotally. I don't know if that's how it really was back in the day or not. But I definitely observed that from other schools that I had been at. So this wasn't the first school that I had been participating in curriculum before. I was never in this leadership role, but I was very familiar with how courses ran and the background material. And so I did bring some of that into this. I think as far as knowing what should be covered intentionally, some of that comes similar to what you have talked about previously is practice questions a lot. So we have access to, and I think in this regard is a really useful tool, retired test questions from the STEP. So we can look at those, and it's very secretive. We're not allowed to talk about in detail with those. We can't show you that material at all, but we can look at it in the back end. And there is a breakdown for those UMS only topics. So it's not just cell biology, there's subfields of that as well. But even those are very broad. So looking at these retired questions, the more you look at them, the more you try to see, okay, what maps to these objectives, the more you get a good sense of what they actually mean by those objectives. And it gives you a better ability as a course director to kind of hone that for any of the faculty that are giving those lectures. It's while you might really enjoy topic X, they really go more into topic Y. So maybe loosely cover this topic and go into topic Y. It gets challenging, though, with fundamentals of basic sciences because you need to know all the ground material to be able to apply the more complicated material that you're probably going to get assessed on. So that is probably one of the more challenging ones, I think, to get in a nice, neat bow, but we try. So.
And that was one of the challenges that you all worked through, though. I think from our experiences, the charter class through to the following years, everything became much more, I guess, consistent, working with different lecturers and getting everybody on the same page. I imagine that was difficult.
It was. I mean, it's a startup, so it's brand new. We were trying to get everyone acclimated. When you're going into something like I previously was a postdoc at WASHU, when you go into a system that's existed for over 100 years, don't quote me on the actual time it's existed, it's established. So something has already come before, and while that's modified significantly since its origin, there's always something that you can grow from. So coming in really from scratch and kind of asking for a different system that most, I think, the faculty weren't used to because they're used to teaching in other programs and that weren't necessarily the medical school. It's challenging. So it did take a lot of practice, reassessing what the material was. But we got there. I think it's improved. I never think that fundamentals or any course is ever going to be perfect. It's always something that has to get reassessed every year. Right. It's going to evolve every year. I mean, when you all were in the first pre-clerkship year, COVID was not an element to talk about, but it will certainly be one, especially in CPR. There's sessions on COVID now.
Wow.
That's pretty cool.
Yeah.
I would say we got through it, though. We got through the fundamentals part. And then one more thing, this reminded me because I heard you talking. The whole idea is our charter class, we're supposed to be a class of trailblazers. I think maybe we are. I don't know. But you yourself also a trailblazer. I'm going to say the obvious. You're very young. Yes, very much. I saw you at my interview day, and I thought you were one of my fellow interviewees. But you were actually the assessor for our mock PBL. And I remember looking at you and going, "Hey, dude, what's up? I didn't see you earlier in the room."
I remember this, actually, yeah.
And I was like, "Oh, that guy seems cool." And then when you introduced yourself, I was like, "Oh, no." But there you are.
I messed up.
Yeah, I messed up. So tell us about your path. You're kind of a lifelong academic person.
Yeah, I think I wanted to ask that too, because the extent of what I know about you, unfortunately, is that you're the course director and now you have other roles at NSU MD, and unfortunately that's kind of the end of it. So yeah, I'd love to hear more about your background, how you came to be here, and all of that.
All right.
Start off, where did you grow up?
Where did I grow up?
Yeah.
I mean, I was born in the D.C. area. My parents...
That makes a lot of sense.
Why?
You wear nice suits.
I wear nice suits?
Yeah.
I didn't wear suits until this job, actually.
Well,
so I was jeans, T-shirt kind of thing.
It was within you to know what suit to pick.
Awakening kind of thing? Okay.
It happened.
All right. In either case, I was born in the D.C. area. My parents had me rather late in life. So by the time I was 2, my dad retired. My mom was already around that as well. So they moved down to Florida because that's what you do when you retire. She didn't like the water, so they settled on Orlando, which at the time wasn't all that interesting.
Which is where Mitch grew up.
Which is why I'm not all that interesting.
I didn't mean that.
No, I know.
Yeah.
Also from Orlando, though.
It's grown a lot since 80s and 90s, so it's different. But yeah, it was a rather small at that point, very focused on touristy stuff. So, and retirement villages, which is what I grew up in, was essentially a retirement village. So I don't know if that speaks to how well I can do in academia, but I'm used to being surrounded by people older than me.
Older people.
Yes.
Okay.
Yeah.
And do you have any siblings?
I do. I have an older sister.
Okay.
She's 10 years older than me. No.
Okay.
So again,
this really gives insight to your level of maturity.
Oh, yeah?
Yes.
Yeah.
Because you are younger than me, but like decades more mature
Okay.
than I. Okay. And then so you grew up in the retirement villages.
Yep.
And then what? You went to, where'd you go to undergrad?
I went to UF. I got
Okay.
a degree in zoology. It wasn't intentional. I originally went there. I wanted to be a bioengineer. So I did that. I was, for some reason, very focused, though maybe you can relate, wanting to get done in a certain amount of time,
Right.
whatever. Somehow the clock seems to be ticking for whatever. So I wanted to be done with an engineering degree that they said would be 5 years in 4 years. So I took 18 credit loads just to get done with everything. I wouldn't recommend it. It was a lot. But as I was going through that and I started hitting the bioengineering required you to do all the sciences up front, and then you would do the engineering classes. So about a year and a half in, I was switching to the engineering ones. And at that time, bioengineering had not really come into its own. It was, especially at UF, it was merged with the agricultural engineering department. So it was mostly agricultural courses that were available. And the only bio ones were on plastics. So I got the sense that if I was doing this, I would end up being basically making catheters for a living. And I didn't want to do that. So
Fun.
I switched the major, and when I went there, I was already working. I worked all through high school and the like and Publix, but I had this idea.
Hold
Yes.
on. You worked at Publix?
I worked at Publix, yes.
What'd you do there? Did you make cakes? I imagine you made the cakes in the bakery. Did you make
I jumped
the cakes?
around in roles. When I started, I don't know if they still do, but they hired at 14 at the time I was doing it. I was a bagger. I then went into working in produce for a while because that was honestly one of the easier ones. Like you just, once it's all up, you don't have to do too much else and just hang out the rest of the day. It's kind of nice. Just have to make the fruit look organized, right? So it was pretty fun.
I feel like that's a good quote.
Yeah.
Yeah.
That's all you have to do.
You just got to make the fruit look organized.
So, question, can you say something for me?
Sure.
Do you need help to your car with this?
Do you need help with your car to this? I always particularly didn't like, I hope that, I won't get in trouble. I don't work for them anymore, but I didn't like that they would specifically tell like baggers, you can't accept tips. You have to deny tips.
Oh.
And I distinctly remember, because most of the time they would never do it anyway, but one person giving me a $50 tip, and I was like, I'm not saying no to that. So I just took, but I got written up because they saw that, and I was like, $50 is like
$50 is 50
2
bucks.
days
Yeah.
of salary. So yeah,
And
you can
look
write
at
me
you
up.
now.
What?
Look at you now.
Oh, look at me now. Yeah.
Look at you now. You don't need that Publix job.
No, I probably do, but it's like
It made
No,
you who
it's
you were.
fine. Yeah, so I mean, I did that. But when I went into college, I wanted to work in a lab because I thought that sounded cool. So why not? I work in a lab. The only lab that would hire me, because I wanted to get some sort of pay, was a horseshoe crab lab. So I did that. It was a parental. They're polyandrous, the species. So they're multiple males, one female. So it was a lot of collecting samples, collecting eggs, and doing genetic tests on them. So it was basically I was doing the who's the daddy for all the,
Right.
that was my
cool.
job.
You were the Maury Povich.
I was the Maury Povich of
Yes.
horseshoe crabs, yeah.
Fun.
So I did that during my time there, and at the same point, I was switching into thinking about doing just a bio major. They basically said in the lab, well, why don't you just switch to zoology, because then you can get like credits for working in the lab. So instead of getting paid, I'm essentially paying them to be in the lab. I think you can commiserate with the whole like
Yeah.
with working as a physician or future physician. So yeah, I did that, and what they don't tell you, I guess UF was really big on this, is that they don't really want to keep you around if you have a scholarship, because they want you to graduate, especially things like the Bright Future Scholarship, which was great. I went there on that. It was, if you're a Florida resident, it essentially used to give you a full ride. I think it's a little more strict now than it used to be. So they essentially looked at my transcripts and said, you are pretty much done with everything. You need to graduate next semester. And I was like, okay, cool. I don't know what I'm going to do with my life. So I said, why not grad school? And I did that. So I applied to grad school and went there.
And you ended up at USF?
Technically USF, the program I was at, funny enough, it was actually a brand new program in itself. It was Moffitt had a cancer biology program they were starting. When I joined, I believe I was the 4th class.
Wow.
So they were about to get it. They were going through a credit. It wasn't really a rigorous accreditation like this because we were part of the medical school. So it was the MD program there and our little graduate program. So we got to use all the facilities that the MD school got, which
very nice.
They didn't really like, but there was only 6 of us every year, so whatever.
And so what did you study?
In grad school, oncology was the degree I got. So
cool.
And was this a master's program or a PhD?
Okay. Yeah, PhD.
Yeah, he's Dr. Bauckman.
I know, but I didn't know if he had a master's.
I could have.
I know he's Dr. Bauckman. I just didn't know if it was like a master's and then you went on to a PhD, or it was a PhD program.
I have no problem with like masters in general, but at the time when I thought about that, I didn't have any debt graduating from undergrad. And I really didn't want debt in grad school. So I thought, hey, why do a master's if I'm going to go down this route anyway, and do a PhD where they essentially give you a cost of living, not a lot above cost of living, but enough. And you didn't have to pay for anything. So
makes sense.
It seemed like a good route to go.
So doctor for free.
Kind of.
Versus we're doctors for the cost of a house.
A nice house.
Depends where you live. Depends where you live.
Yeah.
And then you did your postdoc at WASHU, which everybody knows that place.
I assume so.
Super hoity-toity in the world of research.
It is, yes. Yeah. Yeah.
And now here you are. Wow. Quite a trailblazer.
Sure.
When you were doing your postdoc, I imagine, how does that compare to being in a med school and working from the administration side?
Very different. So as a postdoc, it is a job. So like I was essentially, I don't know, it's the first step towards maybe a faculty position. But at WashU, everything is focused on research there. And that's not to say we don't have a research initiative or anything, but I mean, it was a machine. So it was any of those top 30 schools in the U.S., you probably, if you don't have an R01, then you're probably no longer employed there.
An R01?
R01 is a very nice grant you can get from the NIH. They are going to be in the $1 million range for funding, usually higher. So $1 million is probably an old number because of inflation and all that. But it's essentially for an individual researcher, it's the best grant you can get. It's very competitive. The only thing that would be more is if you had an interdisciplinary grant, which is a U grant. And think of like U as United or something, like whatever you want. And that can be a lot more money because you're talking about maybe funding infrastructure as well. But as far as an individual person engaging their own research, R01 is the best situation you can get. And my PI, for example, by the time I left, had 3 of them. So she had a lot of different research avenues. And it kind of just continuously builds on itself. I think what's not appreciated in research as far as like, oh, why can't you just go out and get one of those, is that the infrastructure really matters. The things that they have that it's hard to go back from when you want to engage in research is they had essentially, if you wanted to buy like lab equipment or anything, like if you want a reagent or an siRNA to knock out something, you usually have to order that from a company. It'll take a week or so to get here if you're in a reasonable area. They had essentially like a floor of one of the buildings, because WashU is essentially half the downtown area of St. Louis. That was just like a Walmart for purchasing items, and they would intentionally have all the supplies there, and they'd get a discount. So like you'd still be paying for it, but it'd be much cheaper, and you'd get it the same day.
So you could get a grocery cart and go shopping.
Get a grocery cart, go shopping.
Did they have the Fisher rats there too?
Fisher what?
Rats?
Racks?
Rats.
Yeah,
Fisher. The white rats that are genetically.
Think Fisher sells rats.
They're called Fisher rats. They're not made by the Fisher brand.
Oh, I mean, I never worked with the white mice. I always did the black 6 mice with that because that was.
Could you pick up some black 6 mice at the grocery store?
Well, you could.
Typically,
so at that place, no, they wouldn't sell the mice because the mice have to be in a special facility and sterile and all that. But they had a pretty nice process for bringing in mice, and you can get them pretty readily. So you can get them probably within a week. They also had elements. So many different elements I can't even think of. They had someone that was like a grant editor that was expert in how to apply and how to get grants. That was just for our department, which consisted of only 4 PIs, and that person's entire job was just looking at grants, editing, and improving kind of thing. And I could go on with things that
because Mitch's eyes are glazing over.
No. I think.
How do you get from there to med school though? Like, how do you get from there to being a teacher to being?
Okay, so about 80% technically of my time at WASHU was doing research. About 20% would have been doing some sort of teaching activity. So I did help with a lot of the medical school activities there. Sometimes I got away with just mentoring students in the lab. So we would always get medical students coming in. We had a lot of different wings, but we were a women's health department, infectious diseases. So UTIs was our bread and butter. So it was a big urology element to it. So we collaborated. My mentor directly was a PhD, but we had a MD that we would basically get all the biosamples we would want from, and he would be on our projects as well. But we'd always got an email.
Sorry.
Yeah, it's cool. We would always get, medical students that would take a year off or do a summer rotation, and it would be in urology. And every one of them, at least said on paper, that they wanted to go to WashU for their residency, but they needed more research experience. They would do that. Except for the ones that decided to go to there was one that went to Stanford or something like that. Every other one ended up matching at WashU after doing the rotation, because part of it's not just doing the research, but you're seeing the physician that is part of the, I don't know if he was the program coordinator, but he definitely knew the program coordinator for matching, and you just got to know everybody because you were there every day, and that really helps a lot. And then you got a few publications even out of it, because with urine, obviously you do some cytology stainings, and
obviously,
there you go. Yeah. Well, it's fairly easy to collect urine. You spin it down, you look if there's neutrophils or whatever, macrophages, if it's a UTI, depending on whatever you were interested in. Is it higher amounts? Is it lower amounts? That's a very small little paper that could get out.
Mitch did a UTI paper.
Almost did. I didn't.
Oh, you actually did not do that.
No.
Okay. Oof.
I do think this is a really good transition point, because obviously you have a really impressive background. You're very experienced in research. Then you have someone like me who's not experienced in research. At least prior to medical school, I have very minimal amounts of research experience now just as a medical student. But for people like me that came into medical school, you're a first-year student, I know a lot of people do have research, but most of the people I know in medical school, like my classmates and even under me, that have pretty impressive research CVs, they were already involved pretty heavily in research, even in undergrad, and I was not. So for a medical student who's come in and they're kind of wondering, could you give kind of a introductory level definition or an explanation of what do we mean by research? I know there's papers, but it's a very broad topic. So how would you define research for a medical student who's trying to learn about it?
All right, I'm going to write this down because I know I'm going to go off tangent, so I want to make sure I get back to your
Tangents
question.
are welcome.
We love tangents.
I want to just address the first part, because you're saying there's a lot of medical students that come in that have no experience, and even then, I know there's a certain degree of flexing when it comes to this is what I've done before and all that.
And I do just want to point that out, because I felt like I was one of the only medical students that just hadn't done research, or I was just left out of the loop. I was like, what is research? What are these people? How are you even getting involved in projects? Who's running these projects? So,
and honestly, I think the acceptance, understanding that you don't know what that is a good place to be, because I think sometimes those that have done research in the past can kind of get into this roadblock idea that I know what I need to do and I know what research is. And this is an anecdote. I'm not saying is anyone here.
Anecdotes are also very welcome.
In graduate school, I mentored tons of medical students that are pre-medical students, so pre-med students that were aspiring to be medical students and they needed research to get into this. At that point, that was my first exposure with that was a box to check, I guess. But my mentor at that time wasn't very keen unless they really showed a dedicated interest on letting them do actual activities. So what it boiled down to and what they did was essentially just clean dishes, like for thousands of hours. And she signed off and she would say, yes, you were here for 1,000 hours. And they absolutely put that on their CV and they put it on their application and it said they were there for 1,000 hours. They were, but they didn't do any research.
So the I guess AMCAS or ACOMAS, whatever, would basically just say, I was involved in research at this lab for X amount of hours, and it's very nebulous.
Yeah,
and
you
that
would
sounds
say,
good.
I'm in a fish lab, and they're maybe doing some DNA editing in the fish lab, but really you're just washing all the Erlenmeyer flasks
But man,
or
you
something.
were there for it.
Or cleaning the fish tanks, because those are awful. But
Ew.
yeah. I would say what I look for usually with that is, okay, you hit a certain amount of hours, so you were physically present for at least 2 months. That would be nice to see. Beyond that, you were there for 300 hours, you were there for 2,000 hours. It's all the same to me unless I can see that you were presenting something at a conference or you have a paper. And particularly if you have a paper that you're a first author or a second author on. Because there are some labs that will just throw everybody in that lab on the paper. And it's like if you're 8th down the line of 20 or something, yeah, what did you do? Maybe you read the paper and you gave like feedback on it. It doesn't mean that you didn't do stuff. I just don't have the confidence that for sure that you did, So
I feel like getting on a paper at the undergraduate level is very difficult.
it can be.
Depending where you're at and what you're doing. My research project was putting teeth in liquid nitrogen and then busting them open with a hammer and separating the pieces.
Yeah.
We didn't write a paper, obviously.
A lot of stuff doesn't always get to paper level. I assume there was more than just busting the teeth.
No, and then we would liquefy them and then put them in mass spectrometry.
Okay, and you're looking for...
Or we would compare the carious teeth, which is, what's that thing? A cavity? Teeth with cavities. Yeah. We call them carious teeth with regular, normal teeth. And we would check the protein structures between the two of them. I did present that at the American Chemical Society conference. So I am better than you, Mitch.
So I'm a pretty big deal.
Yeah, I'm kind of a big deal because of that.
But you did something, though. So you had something, you thought about the project.
I also collected city river water in Denver and checked for bacteroides.
Okay.
To see who was pooping in the water.
Fair enough.
The city of Denver used that data.
Interesting.
To see when the different blooms of poop would show up in the water.
Cool.
Spoiler alert, summertime.
That makes sense.
Good time to poop in the river.
Do some contact tracing of the river.
Yeah, we did like seasonal poop changes in the water.
Oh my gosh.
So that's this. I say that to say that you do not need to have medical research to be involved in the research process to have it on your application and look fine.
And it can be pretty challenging to get like clinical research projects. Even as a medical student, it can be very difficult. And I mean, we can go into I think you want to talk about later the nuances of the types of research, but back to your question, what is research? It just boils down to having a question and applying that through the scientific method. I'm sure you've learned scientific method in elementary school, repeated it over and over. That's all research is the scientific method. It's just applying it over and over until you have some outcome that seems consistent, hopefully consistent, that you can put down on paper, and traditionally is novel. I think that there are issues with that concept. I do think reproduction of data is a good idea. It's weird that you'd have to say that, but it is pretty challenging to get a Me Too paper out of something, as in like I know this person's done this, but I just did it and it showed the same thing.
Isn't that part of the scientific method? It needs to be reproducible across time.
Which makes it problematic when literature doesn't really support that kind of concept.
Is it Is it a funding issue?
I think it might be somewhat of a funding issue. I think it's also just that the journals themselves are a business, and it costs a lot of money to get in those paper journals. So I think it's all about what is interesting, what is novel, what's getting cited. And for you as a researcher too, a lot of your clout depends on you being cited as well. So if you're just doing a follow-up paper to somebody else and it's exactly the same thing, you're not going to get cited. They're going to get cited in best practice. Now, one caveat to that, and it doesn't always make the light of day, and is that if you work in the same field, so I worked in cancer, I worked in infectious disease, but my main bread and butter was iron biology. So if you stay in the same field, it's a rather niche group. So all the assays that you do are going to be pretty much the same assays over and over once you get used to it. At least in like the any field, but I was mostly a cell bio wet lab kind of person, and I did some in vitro stuff or in vivo stuff as well. But like those projects, you sort of end up doing the reproduction of those projects by simply doing your own project, because you have to like do that step to move to the next step, which is whatever your question is. So in a way, you can behind the scenes know that what they did is on the level. And in some ways too, if say like I discover a mechanism and then someone wanted to know a next step of that mechanism or the influence of that mechanism on this kind of tissue, well, they would have to see that the mechanism actually exists for that to even be a thing. So it's sometimes refreshing to see like I had one paper where I talked about a cell signaling process that I was working on, and someone else came out with something similar. It was different, but they inadvertently showed in like one of their figures that the same thing I was doing. So it was nice to say, oh, another lab across the country did the same thing as me for this one experiment. Makes me feel like I'm on the level in some sense. So that part doesn't really get to the public all too often, but if you are as an expert, you should be cognizant of that.
Is there collaboration in term, or does it get sort of nasty? Or do people, is the idea, because I imagine that scientists are affable, caring people who want to share everything with the world, their methods, how they did things, be very clear, very transparent, so we can all reproduce everything together and advance human, knowledge.
Yeah.
But I imagine as humans are terrible anyways, once they get into groups, maybe they're not. I don't know. What's your experience from that? Or
I've seen both ends. So I've seen kind of toxic activities with that, where it's like people take advantage of things, or maybe they're stealing or trying to poach. I remember my first conference I went to was a rather large conference. It was a cancer conference at AARC. I had a colleague, it was a graduate student as well, and she had worked prior to getting into grad school. So she was basically continuing her project. She was presenting on this drug. It was a kinase inhibitor for melanoma at the conference. It was getting a lot of traction. And I remember being off to the side and seeing someone quickly leave, get on their cell phone and be like, don't worry, we are ahead of them, so we can just publish now and we'll scoop them. And it was a weird thing to have to break
sounds
to
like
a
a
friend.
movie.
Yeah, it was bizarre.
Sounds like a movie.
It's like, oh, I actually have like something scandalous to tell somebody. That's amazing.
Wow.
Submit the paper.
Yeah, like it was, but clearly he was tasked to
Our
go to
kinase
that
is
that poster, look at it to see how close they were and if they could beat them to the punch. So that happens a lot, especially with drug discovery projects.
Yeah.
But but on the flip side, though, with iron biology, it's a very small field. I'd say there's maybe 20 senior PIs in it, and they're all very lovely individuals. Like we get together, there's like a yearly conference of like.
I went to that conference.
You did go to the conference when I hosted it here.
Yes.
And they are very open. Like
very nice people, Mitch. You should have gone.
He will probably never listen to this, but Dr. Tomas Gans, he works at UCLA. He is a MD hematologist, and he discovered hepcidin. So,
wow.
The mechanism action for it, I don't think he discovered hepcidin per se, because it was originally thought to just be antimicrobial, but he discovered the iron element of it and how it associates with that.
That's pretty important.
If I discovered hepcidin, that's how I would introduce myself to everybody.
I'm the discoverer of hepcidin.
I'm Samantha. I discovered hepcidin.
Just make your middle name Hepcidin.
Yeah,
Cool.
Samantha Hepcidin.
You could do that. Or not. But anyway.
Did he name it Hepcidin?
No, it was already previously named, because that was why hepcidin is found in the liver, and it's also antimicrobial, so cidin.
Right.
So it had nothing to do with iron when it was known. He found that the whole role it plays is regulating iron.
Right.
So it wasn't known up until that point because it's a very small peptide hormone. It's very hard to like regulate in vitro. But he found that his lab developed a mouse model for the knockout of it, and for a while it was the only one. I just asked him in a conference, "Hey, can I have that mouse?" And he's like, "Yeah, sure, you can have it." And he just sent it. And I had them for my projects. He was very supportive of anything. Always good about asking questions. And he's, the guru of iron, I would say. So it was nice to have people in the field, and everyone was like that, in that field. So
quiz time, Mitch. Do you know what hepcidin is?
Yeah, I think I do.
Okay.
I literally just said it, but yeah.
Mitch, real quick, what's hepcidin?
Oh my God. I was just thinking about this. I was like, oh my God, do I know what hepcidin is? No, it regulates the iron transporter in the intestines.
So it's actually ubiquitous, but yeah, intestines absolutely, liver definitely. So it interacts with ferroportin. So that's the iron export for the cell.
It decreases the expression of ferroportin, right?
So it causes it to internalize and degrade essentially. So then it's pretty much the only one that can get rid of iron as a mechanism. So your cells are just going to hold on to it. If you are a intestinal cell, that means you can't import any inside the body. It's just going to stay in that. It gets sloughed off probably. If you're a liver cell, it's just going to get stored. And they're fairly good at doing that until you get, liver failure.
It's part of what makes hemochromatosis a thing.
It is.
Dang,
Yes.
We're like almost doctors, dude.
Whoa. I imagine you on IM rounds asking these questions, making them M3 sweat.
Mm-hmm.
I don't know
That's
what
for
it
sure
is.
what I want to
don't
do.
know what it
No.
is. Right, what else do we got for Doc Bach here?
All right,
oh,
so-
sorry, I called you Doc Bach.
It's fine. It's fine.
It's a very,
Isn't it? It kind of rolls off the tongue.
it's endearing.
It's all right.
You
It's
have to earn-
endearing.
you have
Dr.
to earn
Bauckman.
it, though.
Yeah, you have to earn
Yeah,
it.
don't go calling Dr. Bauckman Doc Bach.
Yeah, you're not
without
allowed
express
to, whoever's
permission.
listening to this. He is Dr. Bauckman, a learned doctor.
I mean, maybe what we can talk about if you want to pull up that chart. So, from a medical student's perspective, all this is great, and there's obviously so much that goes into the world of research. But in the really nitty-gritty level, you're going to be getting involved in some sort of project at some sort of level, and that level, like we've kind of talked about, can vary from washing dishes at the very low level to really carrying the project on your back, being a first author, doing all the hard work. So one thing that a lot of medical students stress about is how many publications am I going to get? I really need to get publications. That's the end all be all, when there's a lot more opportunities, or there's a lot more things
This
you
is
can do.
important because I think a lot of M2s who have just taken their step one are now misguided and think, well, shoot, since step one's pass fail, now I gotta bolster my research to stand out. And that might be true. It might not, but it might be true. We still have step two. But how does a med student, imagine Mitch comes into med school, he doesn't have any research, he doesn't know what to do, he doesn't even know what he likes. And what I find with a lot of med students, it's either one or the other. You do nothing, or you're doing everything.
And I think it's really easy to do nothing because you're like how I was, and you barely know what it entails, which we just talked about, much less how to get involved in a project and meaningfully contribute to a project, which could result in you being able to put it on your application.
Mm-hmm. So what do? We come to your office, we go, Dr. Bauckman, please, I need help. I don't have any research projects. What do I do? Where do I start?
I would be like, I have no idea. No, I'm sorry. I think there's a lot to break down with that. So the first being, well, what can you do while you're in medical school? Because first and foremost, you should pass your courses, right? So that should be your priority. It's quite often, I have students that come prior to matriculating. They're a week from PI. They're like, how can I join a lab and just do that day one nonstop? And pretty much the first 10 to 20 conversations I have during that fall before they join, or even as they're joining with PI, is I appreciate that you're very enthusiastic, but just hold on, because you need to understand your bearings, how well you're going to be able to perform in medical school. I get sometimes there's a bit of confidence. Everyone has come in as a high performer at some point, but as you know, it's a different game. So it's important to get that kind of comfort. And I was fundamentals course director for up till this past year, and I I intentionally would do that in fundamentals and saying, cool that you want to talk about this, but let's wait until after fundamentals. I would joke that it's because I'm busy, but it's really because I don't want anyone thinking about it at this stage, because you need to make sure you can do all right. With that in mind, though, it's still there's a time ticking with how much you can get done, and up till it's not even at the end of the point you graduate, it's the point that you submit your ERAS. So it's really only like 2.5 years that you have to do that. So I will give a plug and say that for our school, we do have a required research course. We don't mandate it over at the end. So essentially our required research course, we have opportunity at the end of the M1 time frame. So it's like over the summer from July, end of June to July and August. And it's basically the first session you take as an M2. It can be 4 weeks, but you have up to 8 weeks to take it. Anyone that's not an NSU MD student listening to this is going to be like, whatever. But if there's any out there, but
There's some.
There's some? Okay, that's nice to know.
At least 2.
2?
Yeah.
Nice.
At least.
Should,
At least.
Oh,
Yeah.
awesome. Okay, so, but it's the reason for that, the reason we give that time is that for any project that you do, especially an original research paper, in which I'll maybe go in a little more depth on that, you need to have time to get it done, because you can't just do that on the side, not think about what the specific goal of that project is, not being able to really flesh out that project and all the pitfalls, caveats with it, unless you have at least, honestly, 8 weeks. And it's probably more than that, just to get it started. I think some of the other pitfalls that students approach is they think that they can get a paper done in just that 8-week time frame, and that's not true. And sometimes I think that's discouraging. Like, I didn't get it done in 8 weeks, thus why bother? It's really supposed to be something that you get to start it and you continue with it whenever you can based on your workload, and keep doing it until you hit to that ERAS period. The goal should be to try to get a paper, or maybe more than that, by the time that you get to about your end of your third year. At least pushing that out so you can have something, they say, with the submission. With that in mind, though, there's steps to this. And that's usually, as a PhD, you get training with this. It's not just about the final paper. And I guess to talk about that, ERAS has a few listings, right? And I might be wrong. I don't remember offhand what they call them, but they have the original papers. These really should be considered as hypothesis-driven papers. So they need to be that you came up with an idea, you applied experiments to them, you got a result, maybe you went back to it, but you had something novel that was discovered. The other ones are going to be probably falling into the other category, and this is ones that a lot of students will sink their teeth into because they're quick, are things like case studies, or case series is debatable, but mostly case studies. And those are observational projects. Like, the patient just shows up and it has these weird phenomena. You report it. You're not really doing anything. You might say you did some general practice there, but it's like N of 1. It's not applying in a research manner. Case series, you could argue, may get to that, but even that can be sometimes arguable with the quality.
And they're probably the most common.
Very common.
Okay.
Yeah. So those kind of projects are not bad, but they need to be appreciated for what they are, which are narrow in scope. Maybe it's something that could go future towards clinical practice, or if it's really weird, maybe it is a good example to apply towards your specific patient if they have exactly the same thing. But even then, it's kind of dangerous.
Yeah, you're just sharing an example that you saw.
Yes.
Yep.
It's kind of cool.
Which isn't useless, but it's not, like you said, applicable to like most things.
And I mean, as a
low-hanging fruit, right?
Low-hanging fruit.
Low-hanging fruit.
I mean, the joke, and they don't even publish these nowadays. I've noticed that the surgery journals essentially just put them up as an interesting story of the month on their website. But the one that got inflated a lot, especially in the 90s, was like images of stuff up people's butts, basically. So it was like, this
Wait,
is
now we're talking.
Well, yeah,
Okay.
right. Okay. So it's like, how did they go about removing said item?
Okay.
Like, such as, I think there were like the TV shows like made examples of it. How do you remove a light bulb that went up someone's?
I follow a whole Instagram account that is just, they have What's Up the Butt Friday.
There
It's a
we go.
radiology account.
See?
Yeah.
It used to be papers. Now it is a Instagram account.
Yeah, I love it.
That's what you got. Like, so maybe think about it. Anyone listening to that, that's essentially what those are for. It's still interesting. You can post it, but It's not really original papers. There's also editorials, there's also review articles, perspectives, and we could go into each of those if you like. But moving back to the actual goal of this, it's to get you just an opportunity to come up with a research project and maybe get some publications out of it. But along the way, you have to go through each of the process. You have to actually do the experiment. You have to actually collect some data with it. Hopefully you have a mentor that's able to also assist you in some way. And that will be different for each person. And you just have to find someone that works well with whatever your needs are. If you're someone that has zero research experience, you want someone that's going to be more hands-on. If you've done it before, you've done a few lab experiences, maybe you don't need someone that needs like all the time there. You're able to do free creative ideas and they just need to be there to give you some feedback. Pick someone like that. You're not going to really know until you talk with them if they're going to work for you or not. And on that sense, you might not even know if you like them even until you start it and you're down that road. And I often see that's where projects fizzle out. Mm-hmm. And I shifted, I didn't really do this for your group, but I shifted a little bit for the following ones, is recommending you have a dedicated research project you have to do for your graduation. But I also recommend seeking out like at least one other project, like especially over the summer, you have the time to do it. And see which one works out. And maybe if they're both great and you have the time, focus on both of them like in a small amount. But if not, go with the one that you like the most and go from there.
Question about this.
Yeah.
When I think of research, and this might be a very, archaic way to think of it because I'm just a simpleton. I think of it a few ways. I think there are like clinical research, mm-hmm. translational research, which is where you take things from the wet lab to the clinic, I'm assuming.
Sure, yeah.
Which those are kind of harder to come by at our school, probably. And then I think of epidemiological research, which I think as a med student is probably the most interesting research you can do because you can apply it to your patient populations. And then there's med ed research, which is probably the best research.
Not biased at all.
Not biased at all.
No, not biased.
But no, I think that those are are those the main categories that, and then case studies.
So
right?
Case studies would probably fall into the clinical branch, but not like as an original work. But I think you were pretty much on the nose there. I would say that translational probably blends with basic science because translational oftentimes can just still be bench science. Like we did a lot of translational projects in my postdoc lab. But it was urine and blood. Very easy to bring into the lab, very easy to do in a 96 well plate samples with that. So it's technically translational, but it's not the glitz and glam of thinking I'm applying this drug directly towards a patient. And that's not even translational. Translational is really just the broad idea that you can do this.
Okay.
So clinical would be where you're actually doing like a true clinical trial.
Okay.
And I think that's what most students think that they're going to get into is an actual clinical trial. I've not met it, and I know has to be ones out there, but I have not met many clinical trial researchers that want to take on a medical student. They really would prefer to hire somebody that's going to stay on for a while. So if anything, it probably pre-med aspiring medical students that have a job as a clinical research coordinator might actually have some opportunities to engage in that. And there are definitely those situations. But finding a clinical trial, unless you're in a specific school that has just an abundance of it, is probably not so much the case. What clinical really is going to be is probably just spreadsheets. And that, it may be a little disappointing when you see that. It will probably be tons of patient data that's been previously collected, and you will sort and hopefully find something cool maybe based on like what they are specifically interested in, because hopefully they collect it based on that. But you are using an Excel spreadsheet essentially, and it will vary between projects, but that's a lot of it. Survey is sometimes popular, but there's limitations to that. You have to get approval. You have to go through a IRB committee, and something as sensitive as patient data can get a little iffy when you're trying to ask them specific questions that are personal, because it's easy to reveal anything. So it's not impossible. It just takes time, and that's not something that all of you have the luxury of. So they don't tend to be the favorite projects. Epidemiology, as you have said, is a popular choice, mostly because it is kind of it's just like as epidemiology is. You're just looking at a mass amount of data from the population, and you're kind of just extrapolating from it. Usually you're pulling from some sort of Hive database or whatever, or you're focusing on a certain population for whatever. And it does blend into clinical a little bit, depending on what they're utilizing. MedEd, I argue, is just epidemiology for medical students.
Yeah.
So
That's what makes it great.
it's nice. It's in a focused population and everything,
And they're type-A, so they fill out surveys, usually.
Yeah. Though I would push back and say that I generally try to move away from a survey in general. We're a brand new medical school, so you all get surveyed a lot.
Mm-hmm.
So I try to get away from that just because I don't want to subject you to another survey. And you get fatigue from it. So yeah. I generally try to move away from that when I do these kind of projects. I look more at bigger data, like looking at any trends of the school so far and applying them maybe to national trends, whatever it might be, or creating new topics or new activities and seeing how maybe students favor them, or how does it favor performance, or whatever it might be.
Mitch, what did you do for research?
That's funny you say. I was gonna ask you, do you want to just do a quick rundown of what you and I did to give 2 examples of like, students' perspective on like what we actually did?
Tell me what you did. Like, when did you okay, because we have different paths.
Yep.
When did you do your research block? What did you do for your research block?
So like Dr. Bauckman was mentioning, I did the required research block over the first to second year summer. Again, that was my first project I'd really ever been a part of. I met a director of research at a local big teaching hospital that I met through my emergency medicine mentor at the time, and basically just put me on the project. Is like what people say, just like I was one of the people helping out with the project. Like I was very upfront, hey, I've never really worked on a project before, so I'll help you out in whatever way I can, but like I'm gonna need to learn a lot of stuff. But my role was pretty limited. It was just taking electronic medical record data and like pulling a bunch of information from it into an Excel document like he was explaining. And it was good for me because like obviously that was just like lots of tedious computer work, but then I got to see the process of like revising the manuscript and like what went into writing the document and helping with revisions and submitting it and then getting revisions back. And so I got to help writing the discussion, and just it was a really good introduction. And then that project I went on to present a couple times over the course of a couple years. So it was something I got to stick with long term. So it was the one I was able to speak about the most, because people inevitably ask you about your research and interviews, and they might ask you specifically what your role was on a project. And I was able to talk a little bit more about that and be honest. This is my first project, but I did all this and I learned a lot, and it set me up to do later projects. And then I worked on 3 papers with a different researcher at the same institution. I wrote most of like the discussion and the abstracts and really helped a lot with those. And then the last thing I did, I had 5 total projects, was work with a couple classmates in a medical education thing. We talked about SMS and medical education. So like those are my 5 things that I worked on over the course of like 3 years.
SMS is texting, by the way. It's not anything weird.
No, SMS, text messaging basically.
Yeah.
Yeah. So, but from those 5 projects, I was able to make posters. I presented 4 posters. I'm just looking at my application. Presented 4 posters and did 3 oral presentations off some of those projects, and 5 publications total. I did another, one of the 3 projects I did was like I wrote my own commentary. So that was really fun too. But yeah, it was, it was a learning curve for me, but for somebody with no background, it was still very manageable. And I was somewhere in the middle of doing no research, and some people in our class and other classes that just really pump out research through their 4 years, almost to a detriment it can be.
We have classmates that have done we're talking in the high double digit.
Our record holder is over 30, I know that.
Oh my goodness.
As far as publications.
During med school, though.
During med school.
During med school.
So I guess we could talk about that if you like too. Like, what is it? Why do you do research? As far as like the bigger thing. I mean, that's a good question, right? I historically, I don't think most that went to medical school would even bother with research unless they really want to go down that track. I mostly at WASHU interacted a lot with MD PhD students, and I can say that they're very different and like personality type than I think an MD student. And I'm not just saying like, oh, like they're this way and that, but they're very much more like a PhD or mindset, like asking very nuanced questions, and like a toddler that keeps asking why until you lose your mind. That's kind of like the
versus just a toddler, which is the regular medical student.
Which is me.
I didn't.
But why?
No, we referenced med students as toddlers in the last episode.
Oh, that's
Did I do that?
Yeah,
I'm sorry.
And I used the word toddlery.
Yeah, I loosely remember that. Yes.
I love you all. I don't mean that.
But I mean it in the best way, because they asked very great questions, and they were very focused on like that depth. But even then, I noticed that when they do the MD PhD route, you kind of saw after they graduated, they would gravitate one way or the other. They would either be very heavily physician oriented, or they would, because they have to go through both, obviously, for medical school. But a lot would then gravitate towards the research end and pretty much just be doing research. I mean, they collect some patient samples here and there, but they weren't doing a lot beyond that. And I'm sure there's people that would say otherwise, but that's generally what my observation was. But for all of you, because this is a growing phenomenon, this was my take with it, is that there are certain fields that are moving towards a research-driven kind of concept. The two I think a lot about are ophthalmology and dermatology, and
neurology too.
And neurology, yeah. But there's a lot of AI going into those, and it's great for the fields that are like using AI. Is that the data? Like,
yeah, we're just pulling up the chart. Sorry, I just dropped the iPad.
Like shoveling around this iPad with like a bar chart thing.
No, keep going. I'm sorry.
But like there are fields that are moving towards AI kind of handling the job of that physician, the day-to-day. It's not saying it's going to make them completely obsolete, but a lot of what they might have done as a normalcy is kind of going away. It's either that a machine can kind of do it, or maybe one of the staff or a nurse practitioner or someone like that could do it as well, to make it the bottom line maybe cheaper for the patient. So I always saw it as like to make sure your job stays relevant, that your role as a physician in those fields is to elevate the field to the next step. So that is what research is finding what is next, or applying it towards your field for the betterment of the field, because that's the only way it can grow and get better.
Yeah.
And in that sense, while I always was a little concerned with seeing like data, because those two fields in particular had tons of data about you need publications to successfully match, I kind of see why those would do that. Now, I think where it gets toxic, possibly toxic, is thinking that that should be applied to all fields or all positions in all those fields, because I don't think every residency will need research.
Do you want to know which ones have the highest?
Sure. What's the data say?
The data says...
What are we referencing? Just so others can look it up.
Sorry. This is the NRMP charting outcomes data for 2020.
Okay.
And that just has all the... information about those who matched and did not match in the match for all the specialties. And so it looks like neurological surgery comes in at the highest. Their mean number of research experiences, and Dr. Bauckman, remind us, what's the mean again?
Mean? The average?
You want the definition of mean?
There's some questions that make you like question your reality. Like, do I know what mean is? Like, I don't know.
I'm sorry.
Like,
they have an average of 6.1 research experiences.
And just like a reference point,
But
so like
publications is probably okay. So
Yeah.
they have 23.4 abstracts, presentations, and publications.
So I was looking at my ERS application. I was saying I had like 5 total publications. I think I had around like 4 oral presentations and like 3 posters, something like that. But I only had 3 research experiences, because the way that I grouped them and the way that I think you're supposed to group them is like one was with one PI, the other 3 were with another PI, and then the last one was with, it was kind of myself, but it was with a different PI essentially. So those are just 3 experiences that led to a lot of different publications and opportunities. But when she's saying almost 7, was it 7-ish research experiences?
6.1.
So that's a lot.
With 23 abstracts, presentations, and
So
publications.
6 unique experiences that are different from each other. That's a lot in med school.
so that's like, I guess we could break that down, because I don't know the specific breakdown, and maybe you're going to like pull the next chart that does the breakdown. I don't know. But first, you touched on research experiences. that's my perception as well, is that it should be research experiences is based on individual mentors that you had. There might be exceptions where you might have a mentor that you worked in a cell biology lab, but they also are a clinician, so you also did a clinical project with them. That would be different experiences, because the idea is that they're shedding their knowledge or their experiences, and you get a flavor for how they do research, because everyone has a different style. So that's what it should be in my mind as well, but I don't know necessarily that all medical students understand that, and that maybe they're seeing that as a one-to-one, and while some get it and some won't, and that might be why you see such a high number. It's because they're obviously wanting to present the best they can.
Yeah, and like
10.
I put 3 because I remember I met with you at some point, and that was kind of your recommendation. Was like, hey, these are 3 similar projects with the same PI. Let's put them as one experience. So I was like, okay, but I could have easily like just ignored that advice, padded my stats in a way, and just had 5 research experiences, which, you know, it doesn't change what I actually did, but it looks like a higher number.
Exactly.
And nothing was stopping me from doing that.
Nope.
So I guess it is up to you, but
same goes with the publications and the abstracts. So the publications, I would assume that's just an aggregate of everything.
It's abstracts, presentations, and publications.
Oh, all together in one
all
number.
All together in one. So you could present a poster and have your abstract and do an oral, and then have that manuscript published, and that's a 4 right there. Which I guess averages out, right? If you have 6 times 4 is 24, and it's 23. I mean, it makes sense. I'm assuming they're doing all of those things for each experience.
Oh, yeah. I'm looking at my application PDF right now, and it does group, like you said, peer-reviewed journal articles / abstracts, poster presentations, and oral publications, all under publications.
Yeah, they're all under the same thing.
It's kind of weird because it's not a publication, but
so that's important to clear up with people, because when I started med school, I thought, oh shoot, there's no way I'm going to get anything published in a journal, and I have not. And how am I going to have not yet? How am I going to do this? Because for me, the way I always approached research was like, I want to do this project for a long time. It's what I did in undergrad. Like, how could you reasonably go through med school and publish something? Oh my God, that seems so hard. At least do it meaningfully, because when I do something, I like to do it because I like it.
Yeah. Tell them about what you've been working on.
And that's hard. So when I saw that it was broke down into abstracts, presentations, and publications, that's the umbrella of publications. It ended up being a much higher number for me. I think 9. And working on one project.
And what was that?
Oh, I did a medical education project with Dr. Bauckman. I don't know if you know him.
I've heard of him.
I have
Great
not,
guy. If it wasn't for you, Dr. Bauckman, my ERAS section would be null. I would have some undergraduate. Remember when I talked about that ACS conference?
That would be your pride and joy going into residency.
About how I put teeth in liquid nitrogen. Also a calculator once, just to see what it would do. A true researcher.
Of course.
But I've been working on a medical education project with Dr. Bauckman, and we actually use PBL in the interview process. So it is fairly unique to our program. We are the only program that does it. If anybody's interviewed at our school or they're going to interview at our school, we have a PBL portion of our interview. And it's just for you to really get an idea of what the problem-based learning environment is like at NSU MD. And we take that data, because we give them a survey afterwards that we put through the IRB process. We give them a survey afterwards, and we take that data and we see how they even like the process. They like it, but I'm not sure if they say they like it because they have to.
As if it could impact
their admission. It's anonymous data, so we don't track who responds, but I mean, everybody overwhelmingly likes it, and maybe they just like it.
Well, we did it, we were the charter class, and we had a PBL interview session.
Yeah, and I thought Dr. Bauckman was an interviewee.
Right. I didn't realize he wasn't.
Yeah.
Yep.
Yeah, but we did it, and I truly did like it. I thought it was fun. It was definitely way lower stress than being one-on-one with an interviewer, and it wasn't the content of the case wasn't exactly similar to what we do on a day-to-day in our medical curriculum, because you weren't a medical student yet.
Right.
But the format was the same, and the feeling and experience was the same. So I think it was good just to see how you do in that environment, if you like it, and just how it feels. So.
So Dr. Bauckman was kind enough to let me work with him on this project. And that helped us get...
You were the only one that wanted to. But
That's not true.
Well, Uma and you did.
Yeah, she's the best. But we worked on it together. We wrote new cases, and it sort of evolved into this big thing where we now hosted the interview every week. I don't know what you're going to do without me when I graduate, if I graduate. It's become quite a fun project. I'm going to miss it. And we've been able to present that at international conferences and national conferences and local conferences. And
I think it's important to point
that's
out,
pretty
too,
much it. That's all I do.
when you go to residency interviews, like I said, people will inevitably ask you about what research you've been involved in, if you have, which hopefully you've done something. And it doesn't matter if you've been on a few projects like me or one project like Sam. Sam can probably talk more passionately about her one project because she's been involved in it longitudinally and she's been heavily involved in it. And that's fine. Like that, she will.
I love what I do.
Yeah.
I am sad to have to,
And if you can
hang it
express
up.
that to an interviewer, they're going to be like, wow, this person really does care about this one project. And that means just as much or more than just doing a bunch of different things that you may have had a very small part in.
I mean, I think when I did get asked about it on the interview trail, for the places that did ask, they were very genuinely interested in it. And it was something that we could talk about, which was great. And I think I was just meant to do this with you because I didn't do research right after M1 year.
Yeah,
I had to study for my remediation exam. And I was planning to do research. I had it set up to do research in the fancy research building here. I was going to do some cancer research and do some mass spectroscopy stuff.
Oh, okay.
But I gave it up to, because it's better to probably take your remediation exam than to do research. I imagine you should focus first on that. We are med students after all. And then I had no idea what to do. And I just didn't really think about what else to do. I focused on school because that's my primary objective, right? But then when you had the idea and you were kind enough to involve me, I think you knew that it would be something that I would be good at. At least I hope I did. That's what I like to think. And it's been a project that I enjoy. I'm actually I find myself very controlling over who gets to take it over next. And I'm just going to be curious about how it evolves, if it evolves.
Something you said kind of tipped me off to this. When you're a med student and you're trying to figure out how much research should I do, what project should I get involved with, just be cognizant of where you're at in school and if you can handle it.
Yep.
Because I did handle it, but I find myself getting a little dicey being involved with a few projects in the middle of third year, coming up on step 2, and being pretty overwhelmed at a certain point with the amount of free time I had to study for my shelves and prepare for step 2, and knowing that, hey, I have to get out of these projects or wind them way down before dedicated gets here. And some people did projects like we're working on research actively through dedicated, and I just don't think in general that's a great idea, because at the end of the day, like, your board exams do matter more than research, at least as far as like when you look at the program director surveys and things. And I'm not saying don't prioritize research, but if it's going to impact especially your passing courses or doing well on board exams, I think you really need to reevaluate is all I'm trying to say.
We're med students first. I mean, there's a reason why we're not in PhD school. That's for Doc Bach.
Yeah, and if you want to be a research heavy med student, like, more power to you. Like, go for it, but just keep your priorities straight and make sure you're not taking on more than you can handle.
And I think it's still quality over quantity for a lot of this, because you're right. Third year, you're going to get a lot of more opportunities to do like case studies and maybe editorials or review articles, and those are fine. They will help. But what's the difference? At least in my mind, I'm not a program director. But what's the difference between having 10 or 5 case studies when they're deciding you? Or is it really that if you didn't have 10 case studies that they're going to say no to you? Is that really the
I
thing?
think there's a minimal difference.
Yeah.
I think so as well. Yeah.
And I think this is advice for everybody who's listening to this or will be listening to this in the future who's approaching their third year, because you might get this advice. But if you want, you can be that student who shows up on day 1 and goes, if you're doing any research, I'd love to get involved with you. Some
do,
and it's fine, but that's just take that you can be that person.
And I think that you should really use, at minimum, the first half of M1 year to get your feet wet and to get your just bearings and become a good medical student, and then start like exploring research, because you still have the summer ahead of you after the first half of M1 year. And then you have all of M2 year, like you have a lot of time, and you have M3 year. It's a lot of time to get on some projects and do some good work. So right when you come in is not the prime time. And I think we've kind of touched on that.
And there's a secondary thing that I think doesn't always get appreciated, and is that it's not just the research, it's also the fact that you're working with someone like one-on-one much more than you would just if you're in a rotation or wherever. And if you're with a clinical researcher and a field you want to go into, that is a potential letter of recommendation, assuming it goes well and they like you, that you wouldn't probably not have gotten otherwise. So, there's still that. For the M1 students over the summer, there's a lot of scholarships from these nice Ivy League schools that do these 8-week neat and bow research experiences. I really encourage all students to apply. Anyone listening, only from our school. Everyone else, you don't have to. But from our school, please apply. Because they're great experiences, and they pair you intentionally with someone, at least at the time that you're in M1, of what you'd like to do. Like one we have a lot of students go to every year is the MSTAR program. It's focused on aging. It really fits well with us in South Florida because we have a higher aging population than
Where's
most
that
states.
at, MSTAR?
MSTAR is all over. So there's ones in Boston.
Okay.
There's one in North Carolina, UCLA, UCSD. Was it in New York? NYU has one. So it's a grant that NIH sponsors, and there's these schools that apply for it. As long as they can show that they can provide this dedicated experience, there's certain expectations that they have to do, then they get to do it. Since COVID, a lot of them have been pretty good about these projects being pretty much asynchronous. They're still going there, but they can be done virtually as well.
Okay.
And it's just a great experience. Plus, like I said, they're networking while they're doing it. In the best situation, hopefully they're networking. And that's the same idea with going to conferences. Yes, it's great you have an abstract. You have the abstract, whether you're just there mentally checked out or not. But if you go there and actually communicate with people, theoretically in the field you want to go into, it's so much more beneficial than anything else. And if you like your project and you show some spark that you enjoy this, they can see that kind of correlation to this is how they'll be if we accept them into our program. It's all the unconscious things that are, don't necessarily go on paper, but they definitely help in the long run.
What do you think about, for M1s that are just about to start here, or current M1s, even M2s, are all future students here? Now you're getting into this as becoming a more established school. What do you think about upperclassmen or your fellow students being a good resource for research? Maybe they have a project they want that someone needs to take over and expand upon. Is that an option too, or are we not quite at that level?
It's always an option. So you touched on a thing that was rather challenging early on, probably starting after your year, especially when we had that shutdown where a lot of people were kind of doing research projects because they had time, because you weren't going to the clinic right away, where, okay, we have research projects, we need faculty to help with that, but there's only so much bandwidth that faculty can provide. Right. So you have all these students jumping on projects, a new class joins. Well, you didn't just give up your project, theoretically, unless you hated it or something, but you're still on your project, you're working on it. So you don't want to give that up, and they need new projects. So it gets difficult every year up to a point, because now you all are graduating. My phone is telling me it's 2 o'clock.
Ah.
I can't even turn it off now.
It's okay.
Maybe you'll edit that out. I don't know. But,
no, we're going to leave it.
Leave it in? Okay,
yeah.
That's
we love
fine.
Bloopers and we leave it.
Yeah.
Okay. So all of you are graduating. Like you had just talked about, probably going to be able to give up, or going to give up at least some of your project. You're still on the project because you put the work in, so you'll be on the paper whenever it comes out. But that's something that can be passed on. It's usually the role of the mentor, but it certainly helps if the student that was on that project wants to transition it out to help. Because everyone moving on, if you are going to do research projects, you're leveling up each time. So you need to be comfortable mentoring individuals as well. And knowing that, at some point, you won't be the first author on these, that you need to let that medical student be that first author.
Right.
Pay it forward, even if maybe no one was paying it forward to you. Hopefully they were, but if they, that should be how the process goes, is the junior one, as long as they're doing the work, they're writing that paper, they're doing the experiments, they should be that first author. And you should gradually move towards that senior mentor, big picture person.
The last author spot.
The last author
That's
spot. The prestigious senior author spot.
That's the spot. That's the spot that Dr. Bauckman has on all my projects.
When you see a bunch of medical students and then there's one person at the end with like MD or PhD, and you're like,
Yeah.
they're the one really running the show.
That's the boss. That's the jefe.
Traditionally, they're the ones that just like fund everything
Yeah.
because they apply for the grants, but meta projects don't really have funding. But that's
I know we're going to have to wrap up soon because it is 2:00 and someone else, I think, has this room booked.
All right.
But last couple of things I think we should talk about. I want to talk about the RISE conference because I think it's very important. 1, because you created it. 2, because it's our own conference. And 3, it's a good opportunity to get some publications.
It is, yeah. I mean, publications in terms of presenting an abstract.
Yeah. Presenting your abstract, sorry.
Oh, the concept of like calling that a publication just ruffles
Let's
my
call it
feathers.
a presentation.
I know,
presentation.
I'm so
Let's not trigger
sorry.
anyone here.
No,
Yeah,
it's,
I know.
I know that's what
it's
the
a
ERAS
shame.
does. It's weird.
Yeah, I have 9.
Good. It's nice that they word it that way, I guess. I guess.
know.
You're
Um,
an ERAS
I know.
published author.
Sorry.
It's all right.
I'm working on the paper. I know I'm slow,
It's
but
all
we're
good.
getting it out.
It's fine.
We're
It's
getting
good.
it out.
So,
Quality.
RISE, it's quality. RISE conference, the intent with that, most schools have something like this. I was part of helping with one at WASHU before. It's meant to be a sandbox activity for U.S. students. As you had said, you had not had research before. Most don't, and most have not presented at abstracts at a conference or made an abstract or appreciate that, yes, 250 words is typically how much they expect from an abstract. I usually hear from students, can I add a couple more words for the project? And I'm like, no, you can't. It's meant to just get all those questions out before you go to the real game, because you will get disqualified from any conference if you write 255 words if it was 250. Most are good about like not even letting you submit unless it's 200, the right word limit. It didn't always used to be like that. But yeah, so you have to get comfortable with presenting, knowing how to put together a poster. We haven't had an in-person one for 2 years, but even idiosyncrasies like, and we're going to get kicked out soon, idiosyncrasies like...
I was just checking to make sure there's nobody at the door.
When you print a poster, you might make it on PowerPoint and it's like to the edges because you're trying to fit as much as possible. It will get cut off. And I've had it happen before where you print it off, it gets cut off, and then the librarian person is really mad at you because now she has to print your thing again after you edit it.
Right.
And it's a waste of it. So it's all those little work things. And it kind of bleeds to the bigger thing too, where I deliver research sessions for all of you longitudinally as a thread director for research. And the goal I initially did was just, I'm going to teach you research things and what I knew and what I learned. And I think I even had all of you do like a mock grant, which I think you all hated, but that was intense.
I remember that.
Do you remember that?
Yeah, the mock grant.
I didn't
Yeah.
hate it. I
And
don't remember hating it.
I loved it. And then you also had us. Yeah, your threads are good. And then you also
thank
had us
you.
do the shoot. What's the site thing that you had us do? The site manager.
Site manager? What?
The citation manager.
Citation? Oh, you mean EndNote?
Yeah.
Learn how to use that, yes.
Yeah, we learned how to use EndNote. Yeah, I went to my Peds rotation. There was a resident who didn't know what an annotated bibliography is, but
saves you so much time
But
if you
I
know
know
how
what
to use
that
EndNote.
is.
But yeah, I thought some of what I did, I think, was like probably overboard with enthusiasm with it. I was like, oh, you could learn how to write a grant. You probably won't have to worry about that all that much. But what I shifted more towards was, what are tools that you can have in your career that would be beneficial? Like EndNote was a class I did one session on EndNote just so you knew how to use that, because you probably had not used it before, and I'm not necessarily expecting you to. I mean, when you come in to do these the first time, you just assume like things that you do so often.
know.
You're like, surely everyone knows about this because it's common sense to you. It's not necessarily to others, and it's the same with like making a poster or making an abstract. That is an end assignment for the research course, because I want you to actually do it and get that experience and understand that this is the process. So yeah, all the intention with them is that hopefully these are tools that you can apply and be a better, at least at applying research in your career. Not necessarily that you are a researcher, but that you're somebody that is good at understanding how to go about a hypothesis-driven activity. And evidence-based medicine, that's the buzzword, right?
Hopefully someone that can answer the original question of what is research.
What
At least
is
you'll
research?
know.
Yeah, I think just having a starting point, just knowing like, oh, okay, this is how I ask a question. This is how I try to answer that question.
Yeah.
This is my bias that might be inherent. These are things that, this is how I should collect data. This is how I should ask these certain questions. And I think that's all important. If we just walk away knowing those things, or knowing how to go about those things, I think we don't have to discover the cure for cancer. But
and it's appreciation too that like, as much as you hope everyone's publishing good quality stuff, there's a lot of garbage out there. Especially COVID. I don't know if you've seen there's interesting data showing not data, but literally just counting the number of publications with COVID. It's the single largest topic that's ever been published on in the history of publications ever, and it's within the 2-year time frame that this has happened.
Is it just because it's such a hot topic, and if you do happen to find something that blows up, you're just going to get a lot of clout, as you said earlier?
You will get clout, yeah. So it is a publish or perish model. It is also, if you're the first to find this, it's going to be really cool. It's novel, so publish. You get COVID was an interesting example of it, but before that, there was always flavors of the year. Yeah. It would be Zika or Ebola.
Infectious disease is probably a hot topic in general.
There's always new things, yes.
Yeah.
But even things in therapeutics, when I was coming through grad school, mRNA was being talked about as the way to cure cancer, which now is it's just mRNA. Why did everyone freak out about that?
What's mRNA?
MicroRNA?
Oh, I don't know what that
is. It's like
is.
sRNA. It's like
I'm kidding.
It's a little more. Yeah, okay.
I think they make a vaccine out of it, right?
Yeah. Well, that's mRNA vaccine, not miRNA. Micro.
Oh, you're to be mRNA.
Wait, I'm just confused now.
What?
Right. Anyway, yeah. But
this is a good point to end this because I think we're gonna get kicked out. But Dr. Bauckman, what's your best piece of advice for anybody who's trying to get into two things? Trying to get into med school. What sort of research would you want? Because also Dr. Bauckman does a lot of admissions stuff. So
off the record, but
oh well, I mean you're on the admissions.
Yeah, I'm on the admissions.
You do
it's
admissions
fine, yes.
things, right? Oh wait, is that not supposed to be known?
No, it's
Should
fine.
I delete that?
It's okay.
I'm not going to.
Yeah, I didn't think
Okay.
so. But
Unclassified.
So best piece of advice for pre-meds or aspiring med students, and then also best piece of advice for med students.
For research, I guess.
For research, yeah. And life, too.
And
Whatever
life,
you
okay.
want.
All right. For pre-med, I mean, do a project that you can speak highly of and that you understand, because it's going to show when you put into that submission that you did something on that. And be descriptive on what you did, because if it's only otherwise, I'm going to assume you wash dishes. So explain what you did in that. And if you only wash dishes, then say you observed or whatever. Just, I'm not saying you have to admit that you wash dishes, but,
Yeah,
something
I've seen where they write, was involved in a project, and then they make the description of the project is so incredibly detailed with protein names and stuff, and they're not talking about what they did. It just makes it sound really fancy.
Yeah,
and that's just.
And it's also not the end all for as far as admissions go. It's not a requirement that you've done research, and a lot of medical school students don't have it coming in, and that's all right.
Mitch?
Right there.
Yeah.
Mitch just
This
said
guy
you
right
have
here.
it. And that is okay. I mean, unless you're going to a school that says we are, we only do this, we expect this. If you're doing an MD PhD, you probably need to have some background in that.
Yeah.
But otherwise, no, you don't really need that. So if it's something that really makes you interested and happy, then do that and put that on there. Otherwise, focus more on service or focus more on something else that makes you shine as an individual, but doesn't seem fake, I guess. It doesn't look like you just checked a box because I didn't need to do research. For the medical student, similar. Find something you enjoy to do and continue doing that. Stick with it. I'm pretty sure anyone that really cares about research, which I'm not saying every program director cares about it in the most genuine way, but I'd like to think they do, but maybe not. It's do something that speaks well. If get asked about it in an interview, if you aren't able to go all in on the ins and outs of that and really glow about whatever the topic is, they're going to see through that. It becomes very obvious. And I'm not saying you have to enjoy every project, but try to find the project that you like. And don't kill yourself with doing 300 papers or 300 30 or whatever the number is, I don't really think it's going to matter in the end. Like whatever it is that you want to do, if that's what you want to do, keep at it. And if you feel like, because I as a closing thing too, if you really want to be an ophthalmologist, for example, you do need to have ophthalmology publications. Like a lot of these like different fields and residencies, they don't really care what you do as long as you do research for those points, like to check that box. But there are ones like ophthalmology that really want that. And it's not like 10 papers. It's like 1 paper. And like a first author would be a deal for increased odds. If you don't have that and you really want that, consider taking a year off for research, because that will give you that time. A lot of schools that have ophthalmology programs offer year experiences and they give you projects that are practical to get a publication within that time frame. And you're probably working with people that know residency directors. Do that. I talk with so many students that I give that advice to when they say they want to go into those fields, and they're just kind of like, no, I'm not going to do that.
Do you have to pay a year of tuition to do that?
No, you take a year off.
Okay.
And actually, you'll probably get paid. Like,
Okay.
Especially if you do a T32 training grant, which is through the NIH, it's tax-free. So you'll get like tax-free salary.
Okay.
And like you take a year off though, you come back afterwards, and it's fine. You always want to do it right after your step 2 exam. Like you're done with your clerkship, you're at your prime, you take your step 2, you got your number, cool. It is competitive for whatever you want to do. Take that year off and then come back and do your year 4. Never graduate and then do research, because then you're just in limbo.
So
And
finish year 3, take step 2, then take your year off, come back,
Yep.
and then you just have 4th year in application.
Because
Exactly.
you want that U.S. senior designation on your ERAS.
Yes.
You do not want the U.S. grad designation on your ERAS, because then it's like, did this person match or not? Are they reapplying?
Too many questions.
Too many questions.
It's better to go through at the end of your 3rd year. With that said, you have to apply in December of your 3rd year. So you can't just wait till July and say, hey, I think I want to take a year off and apply for one of these programs. You can still take a year off, but you're probably going to, hopefully someone will hire you, or you're going to be doing it out of your pocket. But if you want to do something that's completely paid and they pay you, those scholarships that you would apply for usually are open in December and close in February.
So you should know fairly early if you're going to want to get into ophthalmology,
Yes.
maybe dermatology,
Cardiothoracic surgery,
neurosurgery.
Even if you're thinking that way and you're like, I don't know, maybe my step's not going to be great enough, whatever it might be, you can still apply to those things.
Yep.
A lot of people get to the end of those and then say, hey, actually, I've decided to stay. I'm not going to do this. They will go down the list and give it to someone else, because there's always going to be someone that wants to do that.
Okay.
Just a little caveat too is like we're talking about ophtho, neurosurgery, really specialized things. If you're pretty sure you're gonna apply to internal medicine, emergency medicine, family med,
Gen surge.
more generalist type things.
OBGYN,
like
peds.
yeah, I did my research in emergency, like just covering the things, emergency medicine, the physician workforce, like a couple things on that, and like trauma surgery, and I did internal medicine, and I want to do cardiology, and it didn't hold me back. So don't feel like, I can't do this project because it's not, peds related. Well, just go do it.
They won't care about that.
It's better
I
to
think
have
for
something
residency.
than nothing, and
Yeah.
you can
Absolutely.
always explain, like, you don't have to explain like, why did you do emergency medicine paper when you're an internal medicine applicant? They're not going to ask you that, or they shouldn't.
Yeah, and actually the key, if you want to work in like a prestigious institution and you're having trouble getting in, like, I want to work in this dermatology department, but everyone does, is reach out to the pathologist, because the pathologist has all the data and they have like tons of it to go around, so they can take on more students than any individual clinician can. And I mean, every place I've been, the pathologist in the research institution is the god of the research, like for clinical. So if you know that person, the trick I've told others is like, hey, you see that dermatology group that you want to be in? See who on that paper is the pathologist. Reach out to that person. Don't reach out to the senior author that's a dermatologist, because they'll probably be like, hey, we already have like so many people at our institution, it's not going to happen. But that person probably has projects that might be skin related, and or
So
eye related.
it's a paper that's pathology in nature, but it's related to
Still
XYZ.
related to skin.
It's
It
cool.
says
Oh,
skin on
okay.
the paper. That's what they're looking at.
That's
so.
a good Bauckman nugget right
Yeah,
there.
that's a
Bauckman
really good
nugget,
takeaway.
okay.
Yeah, we should create the Bauckman Nugget series.
There-
Bauckman Nugget.
But yeah, I think you're right though. you can do whatever for most of those fields, and with whatever kind of topic you're doing, as long again, it's the fact that you enjoy it and that they can see that you enjoy it. What they're looking for is, are you someone that can do critical thinking towards a research problem and come up with an answer? Because that's the skill that they want to see when you're applying evidence-based care in the hospital. Critical thinking skills. That's what it comes down to.
For example, I'm applying IM. I don't have any research projects about sodium. It's just a medical education. And I got interviews, so it's fine.
And then the medical education thing is that medical education, you're interested in the next generation.
Yes.
If you're going to be in a residency program that has medical students there, it means that you probably are a great candidate for interacting with those students, and they really want that because they don't want to do that.
Yeah, I'm fully committed. I'm going into med ed. I'm going to work in a med school. I'm going to be just like Dr. Bauckman.
That's beautiful.
You could work here if you want in the future. You have to apply, but I'm not guaranteeing a job or anything.
We'll see about that.
Like,
and on that note,
Well,
no, I love this school. I'm doing a podcast, in the name of this school. So
one thing I wanted to, just before we leave, just because it came up, like I've done some of the interview panels for like the incoming students, and this question has come up, and it's also come up with the M1s and M2s that I've just talked to multiple times. The question is basically, is research more important now since step one's gone past fail? And the answer I gave them, and you guys can tell me if you agree or not, is it's not like it became more important. It's just now you've removed one objective measure that program directors have. So like the proportion of everything else changes and goes up a little bit. So it's sure, is it like more important because there's one less objective measure? I guess so, because that's now another objective measure. But it's not like you're going to go do more research now in lieu of that fact that it's pass fail. So it doesn't really matter, is my opinion.
Yeah, I would agree with that.
Not that research doesn't matter, but the change doesn't affect
how
much it matters.
You don't have to kill yourself to go find some random case report.
And I would worry with the perception of that because, I don't think, like you said, you can only do so much research while you're here. What I worry about is the quality of that research that's going to come out. So don't be tempted, you as a aspiring medical student or current medical student, to do something like that. Just be like, oh, well, they said they can get me like a ton of publications if I just continuously pump out stuff or writing or whatever. Don't fall for that because it's just a very slippery slope. It's not a good idea to go anything like that. It just sounds.
It's also your name too, right? If you're in something that hasn't gone through the rigors of traditional, review, then that's not good. You want to go through the review process. You want it to be strict, and that's part of the fun too.
I agree.
Well, on that note, I think it might be time to wrap it up. Dr. Bauckman, thank you.
Dr. Bauckman, thank you.
It was really a pleasure talking to you, getting to know you more, and thank you for shining a light on the often nebulous topic of research.
Hey, it's fun.
Can I ask you how you feel about the pronunciation when people call it research?
Research
versus research?
Honestly, I've never had that question. I've never thought about it.
But you've heard people say research, right?
I've heard it. I've just never processed that. So I'm kind of like,
well, let's
whatever.
sleep on it. Let me know.
I'll think about it.
Wait, also, we have to say, Dr. Bauckman, this podcast, your idea.
Oh,
So
I mean,
we're
I
here
did
'cause
absolutely
of you.
nothing besides, hey, do you want to do a podcast? And then
but you are one of the charter class members of the Sink or Swim podcast.
Yes,
I appreciate that.
You are the overlord of Sink or Swim.
And I don't know how well this sells. Let me know how many hits you get from this. But I'd be happy to talk about other topics like admissions, or if
we would love to do an admissions topic.
Or if you so are bold, you want to talk about the first year of medical school and all the.
We would love to talk. We got to get some more M1s in here. People who have done it from that, the new and improved.
Yeah, and I think each episode we're getting a little better, just understanding how to run the thing. The first time we were winging it for sure.
Yeah,
the second time
we used one mic.
Yeah, we used one mic the first episode because
now we have three.
Yeah, we're learning as we go. Now we have 3 mics going. We got ideas for the future. We can handle up to 4 mics. We've discovered.
Yeah,
so it's
a big deal around here.
Yeah, we're pretty big.
Yeah.
So it's been fun, but thank you for coming. Thank you for listening if you've made it thus far. And until next time, thank you for listening to the Sink or Swim podcast.
And hopefully, just one last thing, this served as the great redeemer for Dr. Bauckman. And now people know he's not so misunderstood. He's just a normal guy like you and me.
Totally, yeah.
Yeah.
He's a good guy.
He's a great
We
guy.
like him, and we're
Thank
gonna
you.
have him back.
Thank you
that,
for
though.
making my ERAS application
What
you know.
it is.
acceptable.
Thank you, everybody.
All right. Bye. Wait, no play out music?
Oh yeah, play out
Oh.
music, please.
Well, I thought you were going to do it this time.
You're the play out music
Oh,
person.
da-na-na-na-na-na-na, play out music. Da-na-na-na-na-na. It's our podcast. Da-da-da-da-da-da. Are you gonna sink? No, you're gonna swim. No, you're gonna swim.
I thought those were pre-recorded. I didn't realize.